Ladies and gentlemen, this is the solution for healthcare in America that we, the people, have been waiting for. My name is Thomas Tabak. Before I became an author, I had an 11-year career in the health insurance industry, and I have a very keen understanding of how the business of healthcare operates. Now, the problem we face today is that basically you have just two proposals being kicked around in the national debate, neither of which provide we the people with the health care we want, nor what some of us most desperately need. So what are we to do about it? Well, I'll tell you what we're not going to do. We're not going to stand idly by while some kings and queens in government rush their system into law. And we're also not going to stand back and hope and pray that the Wall Street business sector fixes it, because they won't. Now, you and I both know that neither Wall Street nor the federal government has our best interests at heart. If we're going to fix healthcare in this country, it's going to take we the people to step forward and be the solution ourselves. Now that means you. You're going to have to make this plan a high priority in your life. No one's going to do the work that needs to get done for your country if you don't. Now I'm going to tell you exactly what we need to do and how we're going to get there. And when we get there, the whole world will be watching. Because you see, the rest of the world doesn't much care for their healthcare systems. They envy what we have over here. So wouldn't it be nice, just once, if on the issue of healthcare, we Americans led rather than follow? Now, let's talk about the problem in healthcare today, because so few in the public debate really have their finger on the heart of the issue. Healthcare in America is a business, and as a business, it operates on the basis of profit. Now, if you can understand that, then you can understand how the drivers in healthcare are creating the so-called crisis. It boils down to one thing: unbridled demand. We have more demand for healthcare in America today than ever before, and it's only going to continue to grow. In 10 years from now, the cost of healthcare will make the rates today look cheap, if we do nothing. Now, the two proposals on the slate right now are not solutions at all, and let me explain why. Number one, we the people are not going to have an IRS-run healthcare system in this country. We're just not. We're not going to accept a bureaucracy telling us what health care we can and cannot have. And we're certainly not going to settle for a bureaucrat making life and death decisions for our catastrophically ill and our elderly. Now let's talk about the private sector solution, because there are those who would say, well, if you help the private sector become more successful, cut costs, become more efficient, realize savings, well, they'll pass those savings right down to you and me, we the people. Well, I've been on the inside of that equation before, and let me tell you exactly where those savings will go. Their bottom line. If we're going to tackle a demand-driven market, such as we have today, then it's going to take just one proven strategy to do it: collective bargaining. And that is what we the people health is all about. We Americans all across this country are going to come together and form the single largest health care buying coalition this country has ever seen. And when that happens, get ready for an American healthcare revolution, because we're going to demand the absolute best rates the industry has to offer. We're going to demand coverage for pre-existing conditions. We're going to demand coverage if you change jobs or lose your job. We're going to demand that you get to see the doctor you want to see when you want to see him. And we, the people health, will protect your privacy, because this is going to be the only legitimate solution of the people, by the people, and for the people, because we, the people, are going to form a private and non-profit healthcare solution. Now let me illustrate just how successful this strategy is in the marketplace today, because it's already in use. It has been for more than a decade. You have healthcare buying coalitions of every make and size all across this country. You even have government coalitions buying down healthcare. You see, they've used this strategy for their benefit, they just haven't shared it with the rest of us. Now, in the healthcare industry, a group of just 1,000 lives is considered a large group. Now, if you're an employer, that's a lot of employees. But if you're a coalition, that's nothing. Now, imagine you're a coalition of 10,000 lives. Do you imagine that the healthcare industry will be eager to come to your bidding table? Absolutely. Now imagine you're a 100,000 life coalition. Get ready to see the industry fall all over themselves for a chance at your business. But ladies and gentlemen, we're not going to stop there. You see, it's going to take a massive coalition of not less than 1 million Americans strong to send a message loud and clear to the healthcare industry and to the federal government that we the people are absolutely serious about this plan. And time is of the essence. You see, in just a couple of short months, our government is going to rush into law an IRS-run healthcare system. And so we have a deadline. By this coming September 12th, we the people all across this country must register not less than 1 million Americans at wethepeoplehealth.com. Now we can do this. We can do this in a heartbeat, but you are going to have to make this a top priority in your life, like your life depended on it, and it does. And you're going to have to do 3 things right now, not tomorrow, right now. First, you're going to go to wethepeoplehealth.com and register. It's easy, it's free, there's no obligation. You're simply saying, I support the We the People Health solution for low-cost, high-quality health care. 2, you're going to find a link on that website called Share Our Solution, SOS, and you're going to spread that SOS everywhere you can. Let nobody pass you by who doesn't understand what we are all about. They're going to want to know. They're going to want to be a part of this solution. So share our solution. 3, you're going to form a group. Now, the beauty with We the People Health is that you don't have to be an employer to have a group. If you have a large extended family, you have a group. If you have a large circle of friends, you have a group. If you belong to any social club or any community whatsoever, you have a group. Download the registration page off the website and upload your group to wethepeoplehealth.com. Now, if you do these 3 things, and you do them in an urgent manner right now, not tomorrow, right now, then you and I and 1 million other Americans all across this country are going to meet on September 12th. And we're going to announce to the world what we the people of the United States of America can do when we put our minds to something. And you know what? We're going to have our health plan. And you know something else? The rest of the world will follow.